नहीं नहीं माइक में बंद करो.
से
नहीं नहीं बस शुरू से बस लगाओ कर nephrolithiasis. Let's start talking about nephrolithiasis. No, no.
असल की नेटवर्क प्रॉब्लम के जनाब. Okay. Hello, hi, how are you? So now we nephrolithiasis. Nephrolithiasis is actually renal stones. Now we will discuss the basic pathophysiology of nephrolithiasis, how these stones are formed, why these stones are formed. Actually, normally we don't need these stones to be formed. So there are certain reasons behind the formation of these stones. So we will make it really simple. Uh, we will start with three basic reasons which leads to nephrolithiasis. So first of all, let's discuss that we have urine, and in urine basically it is a solution. It is a solution which contains solvent and solutes. So the water content here in this solution is acting as a solvent, in which the other solutes are dissolved in it. So if we have decreased urinary solvent, so decreased urinary solvent, the decreased water content of urine which occur due to dehydration. So it leads to the supersaturation of the urine. When the urine get supersaturated, so the solutes inside it start precipitating. So when solute get precipitated, it leads to the formation of crystals. So when a lot of crystals are formed, it can lead to stones. So this is one mechanism. How in dehydration renal stones are formed. The basic pathogenesis, or basic pathophysiology is actually the supersaturation and this precipitation. The other mechanism is the stone inhibitors. So stone inhibitors, when the stone inhibitors are decreased, it can lead to stone formation, because the basic mechanism of these stone inhibitor is to inhibit the formation of stone. So when these inhibitors are decreased, actually what happened, uh, stones are formed because the inhibitors are low. So we have two things here. One is the pH of the urine, and the others are the some other substances. So when urinary pH is high, acidotic. When the urinary pH is low, acidotic, what happened? Uric acid and cysteines are precipitated and crystal formed, and these crystals, when accumulate in a bulk, it can lead to stones. While if the urinary pH is alkaline, that if this pH is increased, so calcium phosphate and struoid stones are formed. Well, now let's talk about this another molecule, that citrate. So citrate is actually a stone inhibitor. How citrate inhibits stone formation? Citrate actually attached to calcium, and there is no further calcium for oxalate to bind. So in this way, calcium oxalate stones are inhibited. So if urinary citrate level is low, so what's happened? If the urinary citrate level is low, so there is more calcium ions which reach the distal tubules, and they get attached to oxalates and to form calcium oxalate stones, which are the most common type of renal stones. Now we have a third reason. If we increase the concentration of these solutes which are present in this urine solution, so when the solute concentration is increased, again the same thing occur as that occurred in the decreased amount of solvent. This time we have increased the solute like calcium, uric acid, oxalates, and cysteines. When all these things are increased in concentration, it can lead to the saturation and then supersaturation. So when it gets supersaturated, these solute can lead to the formation of solute precipitation. When these solutes are get precipitated, it can also form crystal in this way. So in summary, nephrolithiasis occur due to decreased urinary solvent, increased